Is it started?
Okay, Ika, the floor is yours.
Thank you. Good morning, good afternoon, and good evening for all people that joining us today. My name is Ika Novianti. I'm Advocacy Officer at UNAIDS, the regional network of young key population in Asia and the Pacific. So today I will be the moderator for the introduction and opening remarks session for this meeting organized by UNAIDS Asia and the Pacific in collaboration with the PACT and UNAIDS. As we all know, the HLM on HIV and AIDS took place between 8 and 10 June 20 and 21. So the HLM reviewed the progress made in reducing the impact of HIV since 2016. After weeks of robust discussion, the 2021 United Nations General Assembly high-level meeting on AIDS drew to a close with adoption of new, ambitious, and achievable political declaration on HIV and AIDS, setting forward in motion to path to ending inequality and getting to track to end AIDS by 2030. So in the lead up to the HLM Youth Network and at the regional and global level, including network of young population, young people living with HIV and other youth group, organized a consultation and webinar, launched regional and global campaign, develop HLM advocacy tool on meaningful engagement. So now that the political declaration has been adopted, it's critical to reflect on outcomes of the HLM and the political declaration and see how we can pave the way forward for an inclusive and meaningful engagement of young people in the HIV response. And the objective of these events are include to continue the momentum after the HLM, to reflect on the HLM, the outcomes of political declaration and what this means for young people, and to discuss the next step, action point, areas of involvement, and how young people can meaningfully engage in the future of HIV response. So we have an amazing speaker for today, so let's get started. I would like to introduce Mr. Aaron Sunday from African Network of Adolescent and Young Person Development. Aaron is a public health specialist, a global influence, civic leaders, public speaker, activist, and a FACT 2021 Fellow B award-winning advocate and researcher with over 8 years of experience in establishing operational optimization across diverse organizations, both at the state, national, regional, and international, and also the global level. He is a fervent activist for HIV and SRHR issue for adolescent and young people, particularly young women and other young key population. He currently serves as the executive director of African Network of Adolescent and Young Person Development and youth member of the Developing Country NGO delegation to the Global Fund Board, and also Speaker Bureau at the Global Fund Advocate Networks, also youth member of advisory group on regional humanitarian issue for UNAIDS. So Aaron, I hand it over to you.
All right, thank you very much, my dear colleague Ika. Thank you very much. And good morning to everyone from this part of West Africa, Nigeria. Basically, I will not say, I just want to share my own perspective engaging on the multi-stakeholder task force team. For me, it was quite an experience that I cherish because I wouldn't say this is the first time. I know that 2016 we had something, a same-like process, but this other time I can say we as the young people were able to really influence the process. Right from the process whereby we started designing the planning of how the HLM itself and also the multi-stakeholder task force hearing meeting will be, influencing the process by ensuring who are the speakers, what is the talking point, and does this really fit into the needs of young people? I know my colleague Molly was also part of the multi-stakeholder task force team. And we tried our best to always make sure that whatever talking point or whatever sessions or whatever document it is that is being developed behind the scene, we try to make sure that the needs of adolescents and young people in their diversity, including the young key populations, the LGBTQI, things that are mainstream into the document. So going beyond just planning the multi-stakeholder hearing meeting, we tried our best. I remember vividly, again, we had to support some young people who had speakers, uh, people like Faith Onu, I know Yana, and I think Alan was also part of so it was quite an interesting process because we have to bring in our expertise together as young people with working in diverse field with diverse population to see that we speak in one voice. Again, just like you have said, there are multiple consultations that came in from majority of, from I would say it covers almost all the region. And we are working behind the scene as well to make sure that such consultation are mainstream into the final document that we develop for the civil society, the action declaration position paper. So we on our own end try to make sure whatever it is that is of the youth, including the global statement that the PAC developed, which was the outcome of the global consultation that was done. We try to make sure that it fits into whatever it is that goes as the final document for the CS. Another exciting part for me and very critical and important is going through the political declaration. So before the political declaration was finalized, I think we reviewed it like almost 3 times. So that gave us an opportunity to look into that document and see the consultation or the priorities of young people. Are they really captured? Are they really captured on what the UN member states are about to negotiate and also adopt as a final document? So it was quite an interesting one. But one of the things that I think we all got discomfort with was during the HLM itself, where you have some member states not trying to buy into the term sexual reproductive health and right. And then we have individuals that are not too comfortable with key populations and the rest. So, and knowing well that we cannot force any member state actually, because they have their sovereignty and this is more like a political space. So, but we can only hope that with the document that has been shared and with the majority that have shown support for it, we can only hope that we build on that momentum to ensure we hold them to account. So for us, we have done our own behind the scene work, and now we have a document. At most, we might not say we are satisfied to some extent, but at least we are happy that the document we have at hand is still something that we can take on and engage with. So as such, I would just appeal that in as much as we are in our diverse populations and in our regions, we should hold this document and begin to see how to hold these member states and all these stakeholders into account, because the gains of HIV, we can all see how COVID tried to shatter everything. And now we are saying this document will only elapse after 5 years. So if we don't strengthen our own advocacy and also accountability processes in country and at the region, then I think in the next 5 years, we'll just meet ourselves and still see that we are still falling behind trajectory to reaching the goal for that 2030. So this is just my take in. I know there's a document again that came in today, which I think I saw the document, but I haven't gone through it. But we hope that this, for me, I think this was one of the best HLM. This was one of the best HLM because young people really engage. Young people really engage because both from Asia Pacific, the ICA, West and Central Africa, the Africa itself, we can see that young people were supported to really engage in the process. But our message to our own continent, like the African Union, is just simple. They should not continue to shrink the space of civil society, and they should not always mute the voice of civil society when it comes to critical, high-level engagement like this, because we are not really happy. Unlike the HLM and multi-stakeholder hearing meeting that you saw young people speaking and also engaging, this was quite different with us in Africa, where civil society are not allowed to speak, only the UNAIDS team who are considered as experts. So this will only be our own challenge, which I think while engaging as a multi-stakeholder task force team, I noticed. So I just want to appreciate UNAIDS for this opportunity, because a lot of young people applied, and I realized myself and Molly Chan were picked to deliver on this mandate. And we are happy that we were able to represent the needs and serve the purpose of young people on that platform to the best of our ability. And we look forward to seeing how we can engage at that global level to push for some of these advocacy, as well as in our countries respectively. Thank you very much.
Thank you so much. Thank you so much, Aaron. So I would now like to invite Mr. Eamon Murphy, the Regional Director of UNAIDS Asia Pacific. As the Director of UNAIDS, Eamon is key ally and great advocate for young people needs, including Yankee population, and is someone we can rely on for support. So I hand it over to you, Eamon.
Very much, Ika. Good morning, everyone. Good afternoon, depending on where you are. It was great to hear Aaron speak before me. So, and I'll come to some of his remarks, if I may. Firstly, just let me welcome everybody. I know people are joining on Zoom. They're also live streamed to Facebook. So it's really great to welcome you to this virtual debrief meeting on paving the way forward for the meaningful engagement of young people in the HIV response. And as Aaron was saying, this follows on from the United Nations General Assembly high-level meeting on HIV and AIDS. We all call it HLM, so I'll go to the acronyms, but let's put it out there. I'd also, in my first remarks, like to express my strong gratitude to Youth Lead, the PACT, and their respective members at country and regional level for their collaboration with our Office of UNAIDS for Asia and the Pacific to co-host today's virtual meeting. Today's meeting is a critical opportunity for you, for young people, to reflect on the outcomes of the high-level meeting. This is your meeting today. And so Aaron was talking about the experts. You're not going to hear from the experts. You're the experts to talk. I don't like that term, that either because someone works for an international organization or has gray hair that they instantly become expert. You are the experts today to talk and reflect on the outcomes of the HLM, and importantly, that political declaration. Like Aaron, I actually think this was one of the best HLMs I've been to. And forgive me, I'm old, I've been to all of them since the first one. And this one was more important to me because the member states had to vote again. Last HLM in 2016, it was the more passive passing of the political declaration. This time, for different reasons, they actually had to push that button and show their country's vote, yes, no, or abstain. And that's a powerful tool for you in your advocacy when you're talking to government officials. You can say your country actually voted for this, right? And that is an important message. The content of the political declaration, as Aaron said, not everything we're going to be happy with. Right? There'll be different perspectives in different places. There are things you may have wished to be there. Stronger language, different language. There's a lot of rich difference this time to the time before. And that's a lot to do with advocacy by young people and others pushing for this change. So it's great to have the continuing and increasing engagement and meaningful engagement of young people, both in the response and today with 12 youth-led organizations and networks from 4 different regions involved in this meeting. It shows how connected, how motivated you all are and how eager to get into this work. And it is generational. We know in our region of Asia Pacific, such a large proportion of new infections are from a whole new generation. And we've heard PEPFAR leaders like former head of PEPFAR, Ambassador Burks, talk about the epidemic in the Philippines. It's being a totally new epidemic. It's an epidemic of young people. So it's really important that you are at the forefront and bringing your voices, the difference in your perspective to previous generations and different risk issues and different contexts. So the meeting today, it's an opportunity to continue the momentum after the high-level meeting, but it's also to reflect on that political declaration, what it means for you as young people, what next steps, what action points and areas of involvement, and how you can meaningfully engage in the future of the HIV response at country level, at regional, at global level, because you as young people are critical to the future of this. I'd also like to acknowledge the important efforts and the work and contributions of young people in the lead up to the HLM. In our region, Asia Pacific, we work closely with partners from Youth Lead, YVC, Youth Voices Count that is, and YPeer to organise key webinars and ensure young people had avenues to raise their voices, both at country and at regional level, so it could get to that global level. I recognise many of the speakers here today were also at those events, and it's great to see you coming into this next stage of the discussions. The virtual youth meeting in May, we were joined by the Department of Foreign Affairs and Trade of Australia. Australia was a co-chair of the HLM process, so it was critical to have them from our region as a partner in this, along with the Ministry of Public Health and the Ministry of Foreign Affairs of Thailand, who are co-sponsoring that event. And it was an opportunity to engage with young people and listen to what you had to say. The Australian Ambassador for Health Security, so not HIV, the broader context of health security, Dr. Stephanie Williams, said at the meeting, and I quote her, "We are in it for the long haul. Hearing from the partners and the young people and their experiences is critical to shaping an effective HIV response." Now, one great example of that was language from that meeting was provided through to another country, Canada, to introduce as language about issues of young people and the use of virtual space. So there were direct inputs through doing these kind of advocacy meetings. So importantly, young people, including young key populations and young people living with HIV, spoke on their expectations for that high-level meeting, the language they saw that was essential for inclusion and the advocacy. There was a note taken of the existing challenges and the barriers that prevented young people's access to services and the opportunities to listen to best practice and YKP-led initiatives from across the region. So that could then be part of the briefings to government delegations negotiating the political declaration. I'm also aware that the PACT had initiatives such as the HLM Youth Engagement Toolkit, which was a great advocacy tool for youth networks to ensure their meaningful engagement as part of that process and wider than just that. Online, there were social media campaigns at regional, global levels. UNAIDS led a campaign in our region, helping to amplify communities and civil society partners and voices. And I see people like Ali Raza Khan, who made statements in this global momentum that started a country and built up by putting his statements and voices out there. So it's really important that we have the real understandings and expectations from people living the reality of HIV today as part of this. As a result, your voices, your efforts laid a solid foundation for future action and collaboration to better understand your priorities, young people's priorities and concerns in Asia Pacific and globally to ensure your needs were included in that political declaration. Now, the HLM has passed. The work has only just begun to implement the political declaration. It's critical that we unpack it, understand what the commitments government signed up to, and talk to them about how they're going to implement it. There are a few specific issues and priorities worth raising to start off. The recurring challenges, issues, you brought them up before, we will hear them again. These are issues that are not hard to address. Not easy to address rather, and that's why the political declaration is a critical tool for you in your advocacy. Young people play a critical role in leading change and promoting innovation. There's so much in the response today to HIV that needs to be retooled based on the issues and the understandings, the ideas of young people. During COVID-19, YKP-led and youth-led organisations have been at the forefront of the response, both to HIV, but also in COVID responses in countries, providing HIV services to communities that need it most and can't access the old services for a whole range of reasons, including lockdowns and fear of accessing a health service. So there was home delivery, there was pickup of ARV, there was scale-up of PrEP and distribution of PrEP to people, as well as online condom promotion. So young people were using online and virtual spaces to increase the uptake of these services, also to provide mental health services in a way that's never been seen before. And that direct peer-to-peer support was critical and always has been and will continue to be critical. It's effective, groundbreaking, innovative, and the potential there clearly to drive HIV infections down. There's a need to scale up differentiated prevention services that cater to the needs of YKPs in their setting. Every country is different. There's some commonalities, but there's a lot of differences. Young people living with HIV also, their lives are different in different places, including redesigning the programs, implementing comprehensive sexuality education, and advocating for a changed understanding of young people's lives today, including their sexual lives. There's a need to focus on developing and implementing mental health programs, supporting young people's access to mental health services. COVID-19 has shown us that is a great need and a growing need as we see successive waves and impacts on socioeconomic, on the very lives of young people across the region. This includes fostering enabling environments, addressing stigma and discrimination, the punitive laws that are in place in many of the countries across the region that act as barriers, such as the age of consent for testing for HIV, for treatment access, contraceptives, and harm reduction. Young people also need to be allowed to design your own programs and implement them. You're the experts, you have the know-how. That said, it should also be recognized that young people are experts and partners in the response of policy and decision-making levels. For this to happen, better mechanisms are needed to support your participation, including your involvement in those decision-making processes. So, moreover, there's a need to provide sustainable and direct funding for youth-led initiatives. And that's why it's also important that we engage youth organisations as well as YKP and young people living with HIV networks so that collectively they can address a number of the common issues. So service delivery advocacy, competition for funding is there. The resource availability and finance schemes are often a barrier for young or youth-led organisations. We need to strengthen the support to youth networks' capacities to access these resources. And that's national resources, it's community resources, it's donor resources. As Ika rightly said at that virtual youth meeting, young people are not only beneficiaries, they are also the partners and the leaders. So it's great to see Ika here again today, continuing that message and demonstrating the reality of young people as leaders and partners. Young people need to be supported and given the space you need to lead. We've seen firsthand that when young people participate meaningfully in developing policies and programs, as well as implementing, that affect their health, the services are more effectively tailored to your needs and to the health outcomes improving. I've said this many times before, but the participation of communities and organisations, including those for and led by young people, is fundamental to the success of any HIV response. It was at the beginning of this response, key populations representing the people at risk, and today young people in those roles are critical to the success of any HIV response, and the best responses in the world demonstrate that clearly. I hope today that today's meeting is just a stepping stone, a starting for the continued action. It's along the path, it's not an end in itself. I've heard there are plans to develop a report and toolkit for youth networks based on this meeting. This will be a helpful guide for networks. We in UNAIDS are looking for ideas from you, how we can provide the tools, the support to you to take that leadership and own that space and get your issues out there. So we'll be very happy to hear other ideas as a result of this meeting. So we're committed to supporting these efforts and look forward to working with you on the road ahead. Let's continue to be active, to be engaged, and build on this momentum. And be loud. You need to get your voice out there strongly in a whole range of different ways. Social media, you all know how to use that much more effectively than anyone in government or other places, including the UN. So you need to get out there and get the messages loud and clear to everyone to hear you. So let me reiterate as I close my deep appreciation to both Youth Lead and the PACT for their support with this event, but importantly to all of you who are giving up your time and commitment working on behalf of many other young people who can't access these type of venues for a whole range of reasons. So I'm really looking forward to hearing the outcomes of this meeting and your ideas of how to take this forward. So thank you very much. Ika, back to you. Thanks.
Thank you. Thank you so much, Eamon, for your support and also the inspirational word. So we're supposed to have Yana with us today, but unfortunately, she's not here with us yet, and I hope she can join us later. So before we move to the next session, I want to remind all of you to give us like on Facebook and also share this event so we can reach a lot of young people to be part of this event with us. And please leave us comment of the question for the panelists. So, okay, now I would like to hand over to Eddie Rudram from the UNAIDS Asia and Pacific to continue with the next session. Eddie, the floor is yours.
Thank you, Ika. Hello, everyone. Like Ika said, my name is Eddie. I am the Regional Consultant for Young Key Populations at UNAIDS Asia Pacific. Great to be here today. So over the past couple of months, youth networks and organizations regionally and globally have been very active, super engaged in the events leading up to the HLM. Young people were finding avenues to voice their expectations and their concerns to ensure that the political declaration reflected their needs and reflected the language that they wanted to see included in the political declaration. And just to repeat what Ika said, and for anyone who's just joining in on Facebook or in the Zoom, the HLM meeting happened on the 8th to the 10th of June. And after weeks of lengthy discussions, the UN General Assembly on the HLM on AIDS drew to a close with the adoption of a new and ambitious political declaration, setting forward motion the path to ending inequalities and getting on track to end AIDS by 2030. So here today, we're going to listen to a few young people reflect on the HLM and the political declaration and break down what went on so that people tuning in who didn't quite get what was happening at that time would have the opportunity to hear about it today, especially how this impacts young people and the future of the HIV response. So today we have a lineup of wonderful speakers. I would like to encourage everyone who's tuning into us on Facebook or Zoom to please leave your questions in the comment sections for our speakers. We will have time after the panel to address any of the questions that you may have. So first, we have Ruby Lawler, who is the International Communications Officer for UNAIDS. Ruby is a passionate youth advocate for drug policy reform and harm reduction, working at multiple levels to reduce stigma around drug use, changing policy to be centered around young people who use drugs, needs and rights, and improve the services to be youth-led, youth-driven, and free of discrimination. Ruby, it's great to have you here. So now we know that there were some issues of harm reduction and people who use drugs was quite contested at the HLM. Some member states had some really strong things to say. So what exactly went on and why was this brought on? What does this mean moving forward?
Hi, everyone. It's really great to be talking to you all today. So yeah, harm reduction was hugely contested. It has been at every high-level meeting, but this year there was some successes. So we were involved in a number of events leading up to the high-level meeting. UNAIDS, that is, I'm the International Communications Officer for it. And we were trying to make sure that our voices were heard, harm reduction was going to be included, and we had a number of things that we were requesting of the countries to be putting into the political declaration. So it was essential to us that harm reduction was mentioned throughout the political declaration as a key component to achieving the global commitments to ending HIV/AIDS, with notice being given to all aspects of full spectrum harm reduction. People who inject drugs are 29 times at higher risk of HIV acquisition, meaning they should be heavily focused on in any plans for ending HIV, especially as they intersect with a number of other key populations at the same time. In the Civil Society Declaration on this high-level meeting, we called for the political declaration to name each of the key populations: sex workers, gay, bisexual, and other men who have sex with men, transgender people, people who use drugs, and people in prison and other closed settings, including naming young key populations as the most vulnerable to HIV transmission. The discussions at the HLM were heated, especially surrounding mentions of harm reduction, as noted by Eddie. Human rights and human rights, although less contended than at the 2016 high-level meeting, with certain countries doing their utmost to remove this language, and in the end, the political declaration being adopted without consensus. We called for eliminating structural barriers, and in the end, such as the decriminalization of people who use drugs, which serves as the main reason young people who use drugs struggle to access harm reduction services and why there is a severe lack of accessible and appropriate services in the first place. There is no end to the HIV/AIDS epidemic without full decriminalization of all people who use drugs. We called for equitable and equal access to HIV prevention, treatment, care, and support services for key populations and those in situations of vulnerability through investing and scaling up access to proven approaches such as harm reduction. What we got? 12 mentions of young people, with youth-led organization being mentioned once, people who use or inject drugs mentioned 5 times, and 1 mention of young people who use drugs, although we are disappointed that this was the only young key population that was specifically mentioned. This is a significant improvement from the 2016 political declaration, in which key populations were only mentioned 2 times. Harm reduction was included 3 times in this document, which is 2 times more than the previous political declaration. However, this document is not perfect and did not meet all that civil society called for, as many of the commitments were weakened by statements such as harm reduction programs in accordance with national legislation. This language can be found in multiple places in the document, where countries can use the argument of commitments not being relevant to their cultural context, resulting in diluting these commitments by countries that can use their current legislation to fight against implementing these essential services. Harm reduction has become more prevalent in this political declaration, alongside the prioritization of combination HIV prevention interventions that meet the needs of key populations, including harm reduction. There are specific mentions of harm reduction strategies for people who use drugs, which is a win, although it is frustrating that there is weak language around the reform of restrictive laws and policies, as review and reform is not enough, and these must be repealed and abolished. Harm reduction services and the needs of young people who use drugs will continue to be inadequate and unmet as long as drug use is criminalized. However, this political declaration can be utilized for our advocacy. We can use it as an indicator for whether countries are remaining in line with it and taking the action they promised to truly put an end to HIV. We must gather evidence of this political declaration's successes when implemented on the ground, and demonstrate how it will always fall short for young key populations as long as our needs continue to be overlooked. We must take the opportunity to be heard at the annual review of the progress of the political declaration, highlighting how the failures of the document are playing out in reality, and continue to leverage our influence over our politicians, ensuring that they resolve these failures at the 2026 high-level meeting on HIV/AIDS. As harm reduction has more emphasis in this political declaration, we must do our best to guide governments to remain in line with their commitments in regards to harm reduction. We must ensure that they do not overlook it and the laws that must be abolished in order for full spectrum harm reduction to meet our needs. Thank you.
Thank you, Ruby. Thank you for giving us that breakdown and for your recommendations. I agree with you. You know, it's clear, the data is clear, the experiences of young people are known, young people are not able to access harm reduction services, and there are so many challenges associated with that. In a way, it sounds like there has been progress, but then some of the commitments was weakened, like you said. So the relevancy of these issues around young people who use drugs is something that we need to continue to advocate for. And for anyone who actually hasn't seen or read the political declaration yet, and Ruby's point, there is a copy available online at the UNAIDS global website, so please make sure you check that out. Thank you, Ruby. Please stick around for the Q&A. Yes, so that'll be shortly. So next we have Alex. I hope Alex is actually here. Oh, yes, I see you. Hi, Alex. Alex is an 18-year-old youth advocate working on adolescent sexual reproductive health and rights. Alex started their advocacy during the 4th National Young People's Planning Forum on HIV and AIDS, organized by the Council of the Welfare of Children. Alex is actively involved in creating safe spaces for adolescents and young people to participate in the HIV/AIDS response in the Philippines, and their organization, Youth for Youth, is one of the youth-led partners of the National Anti-Poverty Commission under the Youth and Student Sector's Agenda for Health. At the moment, Alex is working as an intern for YPA Asia Pacific Center. Alex is someone who I've worked with in the past, and it's great to have you back. So Alex, I know you were there at the HLM, you were listening to every part of the side event and heard all the debates. We know how important language is, so I think it comes as a surprise when we heard in the negotiations that CSE was removed. Sovereignty clause on the paragraph referring to comprehensive information and education, which technically is a way for member states to kind of get out of their commitment. So can you share with us a little bit about the issue around the language of CSE and why this was perhaps taken out of the political declaration?
So actually, during the political debate or during the debate for the adoption of the high level meaning political declaration, the problem was the state of Russia and the other Islamic state and the Holy See, which is the representative of the Vatican and other religious states, wherein they are against with CSE as it is not part of their belief, and there are laws and policies in their uh, state that does not allow this to be implemented. And because of that, it become for me as so it's skeptical, especially if we go to the paragraph 60A of the political declaration. It states there that uh, it has a sense that it is not a priority for you to do it. You can do it if you want to, because you still need to follow your laws. You still need to follow your policies. So you still need to abide with your laws, and that means that it's okay not to reform laws. It's okay not to implement these implement comprehensive information and education because it's not part of your laws. It's against your laws, and it makes, especially if you watch the first debate during the political declaration, Russia starts opposing the political declaration, then followed by other Islamic states, and so it is. I am so glad that many member states did not agree with their in the CSE, wherein it tackles the young key populations like our sex workers, those who inject drugs, those who are in rural communities, and that is something that makes our action to end HIV difficult, because if we do not recognize their rights, if we do not recognize their needs for comprehensive information and comprehensive action or comprehensive abortion, comprehensive combination HIV prevention, it will end up nothing. The political declaration will just be nothing. And so we are glad that many states, including my country, the Philippines, did not agree uh, with the proposal of Russia to remove uh, the comprehensive sexuality education, but then they changed it into a term comprehensive information and education that it could be interpreted talking about sexuality education, but in a sense, it is not totally comprehensive and not totally uh, we are not totally saying that the state should do it, because they still need to follow the their sovereignty laws, and that is the clauses, and that is the loose for us. Because if you review the political declaration, there is no mention of comprehensive sexuality education. Only in paragraph 36 wherein it is said that comprehensive information and education. But there is a sovereignty clause that will make our stand as advocates and activists go low or un, unreliable because uh, the sovereignty clause, as I said. But my recommendation for that, because during the high level meeting, it is said that funding for civil society organizations is a must because they recognize our work. They have already recognized our 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 actions as civil society, and that's why they agreed member states to fund us. They agreed to support us. So what we need to do as CSO now that they are now seeing us is that we do more on CSE, but not just doing CSE, but to work closely with our young key populations because our young key populations are not mentioned during the high political level political declaration. And so if we conduct CSE, we need to engage more and work more to our young key populations. After that, we need to ensure to create evaluation, monitoring, and check for the development changes happen within the community. And then convert that into data because data-driven advocacy is the key in bringing accountability to our leaders and for our call to action. Because if we can show them a data, if we can show them at least a proof that CSE works, maybe they will listen to our calls that we need to implement CSE and we need to include it in the next political declaration. Over to you, Eddie.
Thank you, Alex. These are excellent points. And also thank you for your recommendations. Language does matter, we know this. It helps put our issues on the map. You're right, there are no mentions of CSE anywhere, even though we know how important it is. For young people, CSE is needed. So hopefully we can unpack this a little bit more in the question and answer them. So Alex, please don't go anywhere just yet and stick around for the question and answers. So our next and final speaker for the session is Alan Kandukua from YPAS Global. Alan is a communications, evidence, and influence advisor at YPAS Global. She is an experienced gender, HIV, and SRHR programmer and advocate with 7 years of management experience. She is a gender expert who has proven history of aiding and significantly improving the efficiency and success of SRHR, HIV, and gender-related programs. Alan is passionate about working on issues around adolescent girls and young women. Thank you so much, Alan, for joining us. So, Alan, at the HLM, member states have the opportunity to deliver some very powerful statements that presented an overview of what the HIV response was like within their own respective countries. Can you unpack for us a little bit about the statements and how this matches the realities on the ground? How much work needs to be done in order for us to end AIDS by 2030? And what is the role of young people in this?
Thank you so much, Eddie. Thank you everyone for joining us on Facebook and all the other social media platforms. Eddie, I'll just go direct to beyond unpacking because the government's had this great opportunity for having to vote at the HLM. It puts a lot of commitment to them and it puts a lot of responsibility to them. So that showed that our governments have the power to make the medicines available, the power to make the policies, the policy environment convenient, and the power to support people living with HIV, and especially the young people living with HIV. But are they using this power? So members at the HLM, we saw some member states objecting to acknowledge the existence of some key populations. For example, the young people who use drugs, or other young key populations, depending on the countries that they were coming from. So this doesn't stop us from there. We should also consider that while Africa in particular sub-Saharan Africa, that is my region. It is fine, the most progressive in terms of, it is the most progressive and it has demonstrated the most substantial progress, but it remains the worst hit region, for example, especially with the young people, and the young people especially who come from the Yankee populations, particularly for the adolescent girls and young women who have a higher risk of acquiring HIV and a higher risk of not accessing services in regard to HIV and sexual reproductive health in general. So for example, when a young woman is living with HIV and then she gets, when a young woman is living with HIV and then she has to go to antenatal, she has to seek antenatal services, but she fails to seek these antenatal services for reasons like the policies, the environment in hospitals or health centers. This puts the risk of transmission to the unborn child. So we should also consider, we saw this a lot when the governments were speaking, but this is what is actually on ground. Young women and adolescent girls miss out on going for ANC because they fear being judged, they fear the attitudes that they are going to face in health centers. This needs to end. So we saw people speaking about, states mentioning about COVID-19, but they're also neglecting the pandemic, which is HIV. We are prioritizing COVID-19 over the pandemic, over HIV, and this is going to take all our commitments back from where we started from. It is going to take us back to zero, and considering that the young people living with HIV are already facing unimaginable distress within this period. So what do we need to do? What needs to be done? I think to end AIDS by 2030, we need to take charge and control the tide. The governments need to prioritize the populations most at risk, and we need to stop, for lack of better word, being in denial that the populations exist. Because when we leave key populations to be affected, it challenges every other population that we want to be saving. So we need to work together with the populations to ensure that they are also not at risk of acquiring HIV or transmitting HIV. So we also need to make sure that these populations are able to access the services that enable them to stay free and healthy, also when they are living already with HIV. We need to use the resources that we have, the data, for example, that we already have, to work and ensure that we are ending HIV by 2030. I think the World Health Organization released a report just recently that suggested that young people living with HIV generally have a higher risk of, they're more affected by COVID-19, both in getting admitted to hospitals and in getting admitted to hospitals and also in the mortality rate. So where do we put this population? If the governments need to work to end AIDS by 2030, what we need to do now is to prioritize on vaccinating these the people living with HIV. They should be at the top of the vaccination list. And then altogether, the role of the young people should not be neglected. Let us engage the young people. We know what we are doing and we have the power to do that. Thank you so much. Eddie.
Yeah, I'm here. Thank you so much, Alan, for highlighting the realities of young people and especially young women and girls who are at risk of acquiring HIV, and for giving your recommendations. I'm glad you brought up COVID-19 because this is what we've been hearing from the past year. How has COVID-19 hindered the progress within the HIV response, and what we need to do to ensure key populations and young women and girls are not left behind, and that they have access to critical HIV prevention and treatment services. So, I mean, Alan, if you could please stick around, you're the last speaker, so I'll invite all the other speakers back, Ruby and Alex, just so we can get through some of the questions that the audiences might have. Okay, I'm just checking the chat box and missing. Okay, so we do have a couple of questions, great. I guess I'll start with Ruby then. Ruby, what are some of the potential strategies on keeping the components of harm reduction at the forefront of youth-led programs and activities?
Hi, thanks for the question. So some strategies, I'd say, I mean, the most obvious one would be to continue to advocate for decriminalization, because any sort of service that you're going to be running in a country where it's illegal and criminalized to even be that person accessing the service, it's going to be hindered, it's going to be less accessible, and then also some of the most important services won't be able to be within these youth-led service centers. So yeah, decriminalization, advocating at the country level, international level, as we all do, and ensuring that it's really understood that, especially now with this political declaration and the recognizing that harm reduction is really important and essential to ending HIV, it's important that we also kind of monitor how well these services are being run in line with the political declaration, and then also highlight, look, that's great, you'll be able to run these things now for the first time and it's kind of accepted at an international level, but as long as it's illegal, these are the gaps that will still not be filled. And then also making sure that young people who use drugs are also part of the service provision. Young youth-led services are important and essential, but there's quite nuanced needs of young people who use drugs, and a lot are unknown, unspoken about because of the stigma and discrimination. So really important that they are part of every part of the process of creating the services and then running them as well.
Yeah, thank you, Ruby, and I agree with you completely. Even as an example here in Asia Pacific, during COVID-19, we saw that youth networks were providing harm reduction services. They were from the beginning of the inception of the program all the way to delivering it to people's doorsteps. So we've seen how effective these programs are if young people are involved throughout the entire process. I can't agree with you more. Okay, thank you, Ruby. The next question is for Alex. What do you think some of the key terms or language should be when we're talking about CSE? And what should be prioritized if we're talking about YKPs, and how do we get this moving forward? Did you get that, Alex?
I'm sorry,
It's okay, it's okay.
I can, my signal is poor right now because it's raining. That's why it's become glitchy.
Yeah, it's okay. I can repeat the question.
Hello.
So what do you think are some of the key terms or the language should be when we're talking about CSE?
So maybe what do we need to include aside from insights from CSE is the recognition of other young key population and those who are hard to reach populations. Because although there is a mention of sex workers, there are mentions of those who are inject drugs, but there is no mention of women and girls, our person with disabilities, the LGBTIQ, the indigenous people, those who are in conflict with the laws, and also those who are in humanitarian settings. I think we need to include them in the political declaration because there are people who are vulnerable in having or acquiring HIV because they have different environments, they have different behavioral attitudes, and they have different cultural uh, barriers and societal injustices. And that's why we need to include them. We need to recognize their rights. And that is something that the political declaration is lacking of. The recognition of our young key populations in particular, not just those two mentioned, the sex workers and drug users, but all of the young people. Because we believe that there should be no one left behind. Because there is nothing about us without us. There is nothing about this political declaration if as young people, all of us are not included in the political declaration. Because we matter too. That's for it for me, Eddie. Back to you.
Thank you. I know you've said the quotas before as well in the other meeting. You're right. CSE it's all about recognition. It's all about representation. It's about getting our issues on the map, like I said earlier. It's all important. Thank you so much for telling us what were some of the most important languages, and thank you for being here. So the last final question that we have is for Alan. Let me just pull it up 1 second. Alan, this question is for you. How should young people mitigate the disconnect between member states and how has that impacted the outcome of the political declaration? So in terms of kind of moving forward, what the member states, what they delivered at the higher level meeting, how do we turn that into action, and what are some of the things that young people can do right now?
Thank you so much, Eddie. I think what young people can do right now is, first of all, use the declaration because it is available and it has some good clauses, although it's missing a few, but it has some great clauses that we can use and that can support us to deliver our key messages. We should hold the governments accountable at all costs. We should not stop. Like, the idea that they got to vote this and they got to sign up on it makes them really accountable. So we need to push for the agenda. We need to make sure that we put our chairs in those meetings. We need to make sure that we put our voices out there and they speak loud and clear of what we think works for us, so that we do not let the gaps of when people decide for what is best for us. So I think we should put our tables on the panels, on the high-level meetings, wherever we need to discuss, and we need to hold our governments accountable. That document is here, it can be accessible, and you can know what your Minister of Health or what your government leader said. Take it to them and tell them this is what you committed to in the HLM. We need this to happen. So I think we need to first of all use the HLM document, and we also need to educate other young people out there about what the HLM was and what the outcomes were. So for me, that is where we should start from, and with that, we are going to create a policy, to support in creating a policy environment that we desire to live in. Thank you, Eddie.
Thank you, Alan, and I agree with you. I mean, let's not waste any time, just get working, make our governments accountable, and to really follow up on what was said and what was discussed at the high-level meeting. So the time is now, everyone. The future is youth. Let's not waste any time and let's get moving. So that brings a close to this panel discussion. I'm happy to pass now the mic to Eliza from UNAIDS, who will be facilitating the next session. The floor is yours, Eliza.
Hi, thank you, Eddie. Thanks so much, and hi to everybody. So, as Eddie already introduced me, I'm Eliza. I'm from Lithuania. Well, I'm based in Lithuania, and I'm representing UNAIDS. I'm an international working group member at UNAIDS, and probably most of you know that UNAIDS is a youth organization which is promoting full spectrum harm reduction and drug policy reform. So, after a brilliant first panel discussion and reflections on what we achieved, what we as a young key populations achieved, and what challenges we overcame. I think so it's now a good start, also like a good time to discuss where we are moving forward, like what are our actions for the future. So the second panel is called Moving Forward, Strengthening the Role and Engagement of Young People in the HIV Response. So during this panel, I really would like to invite all our panelists, as well, all of you participants, to discuss about youth leadership and advocacy efforts, gender equality, and also inclusive HIV response. So yeah, we have four amazing speakers today in our panel, and I would like to invite to open our panel two representatives from the PACT, a global coalition of youth-led and youth-serving organization working within the sexual and reproductive health and HIV movement. So first, the speaker is Ekanem Itoro. Ekanem is the UNAIDS youth leader for West and Central Africa and the advocacy working group lead for the PACT. He earned certificates in leadership and management in global health and project management in global health from the University of Washington. He attended a short course on improving the health of women, children, and adolescents from evidence to action at the London School of Hygiene and Tropical Medicine. And he graduated from the Human Rights Advocates Program at Columbia University Institute for the Study of Human Rights, New York, USA. As well, together during the discussion with HLM, there is another speaker, Ali Raza Khan, who is a young people living with HIV activist from Multan, Pakistan, working for this community since 2015 in Pakistan and focusing on sexual rights, sexual and reproductive health rights, HIV/AIDS prevention and peace. He has worked with multiple local, national and international organizations for the rights of young people living with HIV and young key populations. He's currently leading an initiative named High Voices in Pakistan, working for young vulnerable key populations on the ground. And also he's serving as a member community's delegation to the board of the Global Fund as advocacy co-lead in the PACT. So Ekonem and Ali, I would like to ask you, so what is the role of global networks in supporting advocacy, and how to create a positive feedback loop between the global commitments and local action?
Okay, thank you very much, Alicia, and also thank you all for the opportunity to share insights. I want to say first of all that I would like to list out some of the gains in the political declaration, and which should give us more like an insight on what we need to do and what we should be focusing on. We understand that in the political declaration, one of the gains was that key populations were named, and it also aligned with the UNAIDS strategy. There was commitment to support community-led efforts, and also there's also a commitment to prioritize combination HIV prevention, as well as specified funding, basically. At the same time, it also acknowledges the holistic nature of HIV and the strong focus on education and also meaningful youth engagement. However, in all this, we kind of had some losses, which is watering down of some targets, no mention of young key populations, and no mention of CSE. So what needs to be done? So first of all, we need to understand that all these commitments would not be a reality if it's not reflected in our national policies and subnational policies. We as youth advocates are working in country, and the essence is to ensure that what the member states have actually committed to this in the political declaration and actually seen in some of our laws, actually seen in actually captured in our laws and our policies. Basically, if this is not done, then I would say some of the clauses in this political declaration is not yet a reality for us. So as well as we would like to see some budgetary allocations in some of these as well. And we should also be looking at aligning youth movement efforts towards holding governments to account. So basically, most of the advocacies that have been really productive has been collective efforts of youth movements. We could see during the HLM, the PACT Youth Lead, Y Plus Global, UNAIDS all came together with other youth networks to actually see that young youths are actually meaningfully engaged during the HLM process. And I mean, these are some of the things that we should be doing even at the regional, at the global level, to see that some of these clauses here are being monitored to ensure that, yes, the government actually commits to it. I'll get to that to where some of the roles we're supposed to do. And we're supposed to make sure that, yes, we have this strong political leadership as well as adequate funding. Community-led responses are actually respected, as well as right-based approaches. So what are the roles of youth networks? I mean, the youth networks today, the youth movements today has really helped in so many advocacy efforts. And I think coming down from the HLM, what we would like to see is that youth networks are able to support the participation of youths in country in some of their national decision-making spaces, to ensure that funding in the context of HIV and SRHR is respected as aligned in the political declaration. We all know that for community-led organizations that are led by youths in countries, most oftentimes are not really open to opportunities because they don't have access to information. They don't have access to funding to even go to some of these places. So as a youth network, I would love to see that we are able to support some of the members of this coalition, some of the members of this network, as well as I would love to see that we are able to also give them information as regards to some of the processes and ensure that, yes, they are monitoring all this process. As well as we would love to see that networks are supporting the mobilization of AYPs and also engage decision makers for increased access to evidence-informed prevention. I know there was a speaker who talked about how evidence is key, and which is true. And that is why it is important that some of our advocacies are backed up by evidence. And to get evidence, you need to actually do research. And to do research, you need money for that. So the youth networks are more closer to funders, unlike the community-led organizations in country. So what I would like to see is that they are able to mobilize funding to actually support some of the members of this coalition to actually go find this evidence and also use that to engage some of the policymakers and legislators in country, as well as we would like to see that the youth networks are also able to build the capacity or retrain some of these members organizations to change legal and policy frameworks that serves as a barrier to young people accessing HIV and sexual reproductive health information and services. And this is one of the reasons why, as the PACT, we are currently organizing an advocacy capacity building session, because we understand that, yes, there are so many advocacy strategies have not been productive over time. So we would want to see how we can retweak this to see that it meets the current context, in the context of COVID, as well as we're also talking about how we can yield social media advocacy. So all this needs training, and this is why we at the PACT are organizing this, and this will be happening in September. Because we want to ensure that some of our members in country are ensuring that they hold the government to account, and they are doing that with some of the best global advocacy best practices that we know. Then also, I would like to see that the youth-led organization, the youth networks, are able to support the ethical and meaningful youth engagement of young people in ensuring that they also use strategies like youth-led social accountability to hold government's accounts. And at the PACT, we have what we call the uproots, which we're trying to see how we can we can actually use this. The uproot is a youth accountability tool, which basically assesses the engagement of young people in the HIV response in country. It looks at areas of laws, looks at the areas of leadership, looks at the areas of participation. And when you use this tool, you'll be able to assess the youth's engagement in this process. So we are also looking at using some of this accountability tool in training members of the coalition to see that they are using the tool to hold governments to account in country. So these are some of the things I'll be looking at. And lastly, it would be really good that, yes, the political declaration is there, but how many of us as youth have actually gone to open the document to actually read through, to understand how important the document is, what we should do with the document, how we should go about it. I know a number of advocacy guides have been developed, even including with PACT that developed one. However, it would be good for as youth networks, we should go back and see how we can then build the knowledge capacity of our members around what the significance of the political declaration, and see that they use the knowledge to actually engage at the national and the state, at the subnational level. I would stop now and leave Ali Razan to add. Thank you very much, and over.
Thank you, Itoro. As you put a highlight on how we as a global network can play or support advocacy campaigns, just add to what you said, just a few brief summarized comments regarding what as a starting. It is not about just PACT, but every network can play their things as we as a PACT are doing, like simply advocating, as we follow these four themes or our objectives, saying that we educate and enable youth-led accountability and participation for the integration of HIV into sexual reproductive health and rights and policies, including comprehensive sexual education. And like we strengthen young people's capacity to change legal and policy framework that prevent young people from accessing HIV and SRHR services. The third, like we say, we support participation in global, regional, and national, including district, civil, and decision-making process around resources mobilization and allocation to ensure funding for young people in the context of HIV and SRHR. We mobilize young people and engage decision makers to increase access to evidence-informed HIV prevention and treatment. As Itoro said, it is necessary to ensure resource mobilization for young people to engage them and support them in the global advocacy. So what global networks can do is that they actually play as a role of bridge between the decision-making agencies that are making policies and decisions and the people and the communities that are being affected on the ground. So it is important for global networks to be transparent in their actions. It is important for them to engage young people that are being actually affected on the ground. For instance, if we are making decisions related to YKPs or YPL-HIVs, so it is very important, and it should be like a necessary thing that we should involve YPL-HIVs in that specific context in which we are making any decision or policies. It wasn't so as in the before the previous HLM and earlier and the previous, but as in this HLM and in the coming days, like the youth networks, like Youth Lead, Youth Rise, and our network, the PACT, is making and ensuring that young people are involved in these advocacy campaigns. It is very a good thing, and how we can maintain this, that as a young people working on the ground, we have to raise our voices. We should not be kind of waiting for other peoples to come us and support us to speak about our issues. So what my experience is that we by ourselves have to continue our work and raise our voices to a level that these global networks will that our voices can reach to even not only to global networks but to the decision maker on the global level. Just adding to the how we can create positive feedback loop between global commitments and local action. We have to follow these similar steps being discussed, or I have spoke, that engaging young people on the ground at work for the communities and the people affected by the HIV and young key populations. But it is important to involve them into the level that are at the level of decision making. For instance, I'll give you an example of the Global Fund, as I believe it is the agency which has a separate constituency for the communities to ensure that the communities on the ground, the voices of the communities on the ground are being reached at them. So similarly, it is an example which can be followed, is being followed in our networks and in the other youth networks and that can be followed from up, down, upside to at the ground level. What earlier have been observed that on the ground level, young vulnerable or YKPs are being involved due to the restrictions based on the policies and laws. So that were the main factor. But what I can suggest that YKPs, if are being not involved at the ground level, can connect with the regional and global networks as like the PACT, Youth Lead, or UNAIDS that can better represent them and their voices on the global level. But it is very important when we are asking for a positive feedback mechanism to be engaged related to young people. What I have observed, it is sometimes becomes difficult for everyone or YKPs on the ground to be equally involved due to the multiple restrictions, not on the policies. For instance, many YKPs don't have access to internet things, so they can not be engaged with the global networks or the regional networks. Many cannot speak or communicate in their English, so they are usually left aside. So what I have observed, the positive thing is going on around even in this HLM and the PACT and other networks done during this HLM. They created reports in other languages there, and the surveys which capture the inputs of young people and the YKPs that were earlier not being involved in such things. And this is, I believe, is very important when we say how we can ensure that positive feedback loop. So that's from my side. I will go with any question later. Thanks.
Thank you so much, Hitor, and thank you so much, Ali, for great points and actually recommendations. I would like also to remind our participants that if you have any questions or maybe thoughts or reflections on what our panelists are sharing, you can always use our chat box for your questions or even discussions or thoughts. And yeah, actually, very interesting points made in this discussion was that meaningful involvement of young people, it can't happen without some like key points such as like capacity building, mobilization, right? Like how we can do some advocacy if there is no like a group of young people on the national level, for example, without resources, both human resources and funding as well. Access to information is also one of the key points. Like without information, young people basically can't do anything. Also support from the regional and global organizations for those organizations who are working on national level, right? And a beautiful actually thought which was shared during these two speeches was about collective movement efforts, like together we are stronger. And actually we showed it during HLM, right? Like loads of great efforts and changes were made from the last political declaration, because youth movements from all the world united and put loads of efforts to do and create these beautiful changes. So thank you once again, Ali and Itoro, for your speeches, and I would like to ask you to stay until the end of our panel so we can discuss later and maybe have some questions. And now I would like to introduce Aplesta da Costa, who is a program lead, psychosocial support at Human Touch Foundation, a youth-focused organization based in Goa, India. She has considerable work experience with children and adolescents in both clinical and non-clinical settings. Aplesta heads the psychosocial support program for adolescents living with HIVs and young adolescents with substance use disorders through focused therapies and brief interventions. So Aplesta, I would like to contribute and to tell us more about the interventions for an inclusive HIV response with a focus on gender equality. Could you please share your insights and thoughts about this?
Thank you, Elisa, for the introduction. Hi, everyone. Hello from India. So today I'll be taking you through some brief points as to how we can work towards achieving gender equality in the HIV/AIDS response. As we are aware, there is a clear link between gender inequality and HIV. And it is very important that we work towards closing the gender gap that exists in society. Women and girls are more vulnerable to HIV due to constant power struggles and inconsistent inaccessibility to resources, especially in an interpersonal setting. Women are not able to negotiate if they want to engage in safer sex. They have no say in whether they or their partners use a condom. They are at a disadvantage in the decision-making process. So gender inequalities and gender-based violence rob women and girls of their fundamental human rights. When women are empowered to protect themselves in reducing the risk of getting infected, it would make a huge difference on the road to eradicating the HIV epidemic. Understanding and addressing the barriers to women's access to health and HIV services needs to be taken on priority. Majority of the young women do not access services due to the prejudiced attitudes and comments expressed by healthcare workers. So anti-stigma workshops to improve knowledge and attitude of healthcare workforce will have a positive impact in reducing stigmatized behaviors towards people living with HIV. We also see that inadequate education, lack of exposure to mass media, poverty leading to financial dependence, and differential attitudes towards women is attributed to higher risk of HIV infection in women. So women need to be provided equal opportunities to educate themselves, to gain employment, to acquire the necessary awareness surrounding HIV and other health issues, and they need to be linked to social protection services. So it would foster independence and ensure that they are not tangled in the system of patriarchal dominance. We need to implement a proper system to monitor that the support systems that are available are effectively used by these women and young girls who need them. We also see that inequality is the reason why young women from vulnerable groups are least likely to access services when they need, which they need to survive on. So easy accessibility and affordability to HIV and sexual and reproductive health services will promote health-seeking behaviors among individuals who are at a risk of acquiring HIV or those who are already infected by HIV. We majorly see that there is a disconnect between people who work at the grassroots level and those who are in authority to take an action. So here we need to, make the government take accountability for their actions, and governments must synergize with civil society organizations and other organizations to address the gap between knowledge and actions so that they can better understand the problems that are deep rooted into the community. NGOs, CSOs, and other faith-based organizations need to be added into the health system. This would only ensure that there is a comprehensive approach in addressing gender-based violence, sexual and reproductive health rights, and HIV. Now, also involvement of youth as a major stakeholder needs to be taken into consideration. As we saw from the Generation Equality Forum that was recently held in Paris, it displayed a poor youth engagement where prominent speakers and experienced speakers were given more preference over young people. Now, young people are the future, and helping them amplify their voices will ensure a pathway to leadership growth. So in a world that is changing at a very fast pace, I think engagement of youth will definitely ensure dedication and accountability. Equally, training young women to be advocates and leaders can further aid in the HIV response. So introducing trainings which are highly reflective and participatory would create a very supporting learning environment where women can also share their expertise and experience and learn better. And interventions surrounding eradication of gender inequality, it ought to be community led. So there should be greater involvement of gender non-conforming people, men who have sex with men, female sex workers, and the other young key populations which would only help facilitate a receptive change that can make a society more just and equitable. Involving policymakers and lawmakers is also very crucial if you have to address the gender inequality. The gender policy cuts across aspects of health, education, social norms, employment, finance, and so on. So policy makers need to have access to reliable and relevant data to understand the scale of problems that are faced by women and young collaboration of all major stakeholders necessary to promote better health systems, access to treatment services, promote testing, prevent new HIV infections and AIDS-related deaths, and also eliminate stigma and discrimination, ensure well-being and productivity of people living with HIV. So in the words of Winnie Byanyima, and I quote, "We cannot prepare for or defeat a pandemic unless we tear down inequalities, promote people-centered, right-based approaches, and work together with communities to reach everyone in need." Thank you.
Thank you very much, Aplesta, for great insights. Actually, you made loads of good points and actually recommendations as well on how we can improve these inequalities, right? And how we can actually achieve gender equality. And additionally, I think so to what you already said, I would also think that important things are peer involvement, because like women support women, and I think so that loads of women can also bring like their peers and bring out the voices of more women as well. Training professionals, experts, because loads of people are kind of this classic view that why we need separate services for women, for example, why do we need some specific interventions. And another thing which is like very ridiculous always for me to speak is about our decision makers who are actually making decisions without knowing, like the needs of women, the needs of like specific needs of these particular key population. So so yeah, thank you so much for great insights, and we will keep the discussion later on after our fourth panelist, Kalisito. So Kalisito Viaukula, they are a Pacific queer feminist activist from the Fiji Islands, currently working as the technical support of Youth Voices Count. They are also pursuing the International AIDS Society digital initiative to support young leaders. Kalisito, I hope you are with us. And yeah, I would like you to focus and to discuss more and tell us about inclusion at the center of HIV response. So what recommendations, what insights you could bring about inclusive HIV response, what it is, like how it should look like, and what are the recommendations for this inclusion?
Nissan Bulvinaka and Talofa. My name is Kalisito Biakula, and I'm the advocacy manager for Youth Voices Count. Thank you. I would like to also share that in this part of the region, where there is a deeply entrenched by homophobia, transphobia that prevents prevents people of diverse gender identity and sexual orientation from achieving the fullest development and attaining their human rights. And the violation, discrimination, and stigma, that takes an enormous toll, and they deny enormous toll on their health and their livelihood. People of diverse sexual orientation and gender identity so far in the Pacific, as a young trans feminist activist from Fiji, so far in the Pacific, there's 5 island countries that has significant progress around sexual orientation and gender identity on SOGS, which is centered especially on the decriminalization, on the sodomy and the comprehensive of constitutional provision on the grounds of unfair discrimination, which includes sex, sexual orientation, gender identity, which is still missing, which makes invisible rights of people and children who are intersex. However, there's a serious human rights violation. There's a serious human rights violation that continue to exist within the queer community, as the current policy and law that either inaccessible or inadequate to protect and promote some of the most vulnerable members of the community, as violence and discrimination against people of diverse gender identity and sexual within families, school, and local communities, and the broader public. It also led queer students to likely to avoid going to school and also drop out from school due to the discrimination and violence being experienced. And I would like to also, we need to ensure that there's an intersectional, intergeneration, and human rights-based approach to achieving gender equality and the empowerment of young people of all diversities across the region. Only then we can significantly reduce the harm and the non-inclusive policy that have been on our community, and we must fully recognize the do no harm principle and leave no one behind. And there's a need to consult and raise awareness in all communities in the region. And also we need to really decolonize the conversation around gender, sexuality, and incorporate comprehensive sex education curriculum as a priority by the government to start in educational institutions by teaching safe sex, and also awareness on adolescents on their gender identity and sexuality. In this, it is also important that the most valuable process at the high level meeting is to contribute to the fullest of the human rights commitment for key population. In our case at Youth Voices Count, we hope to spotlight that the denial of the rights of LGBT young people, youth rather, has been profound effects on HIV and AIDS as access to treatment and prevention. In the progress of reviewing the process of reviewing progress made in the reducing the impact of HIV since the last high-level meeting back in 2016, let's all ensure that population are included. This means include population who MSM, men who have sex with men, transgender, other sexual and gender minority like the lesbian, gay, bisexual, and intersex and queer people. And there's a movement to ensure of inclusion of people of diverse SOGS in a discussion surrounding the high-level political forum. During the high-level meeting delivered a powerful message reminding us that the structural barriers that prevent LGBT persons from their fullest and full and equal enjoyment of their human rights, including their rights to the attainable standard of physical and mental health that prevent them from enjoying the similar health outcomes as the rest of the population. HIV and AIDS, from the SOGS perspective, has to be reviewed viewed from an intersectional lens. That LGBTIQ community are still not facing the HIV and AIDS problem as rather it made worse due to the lack of social and economic empowerment policies and the political will that look after the vulnerable population at high risk. And the user-friendly medium and the health services to ensure that the professional able to communicate and understand the situation of the community will go a long way in increasing the access of and the use of SRHR and the HIV and AIDS services. And there's also been a quick understanding of the realities of LGBTQ communities, rather in the Pacific, queer teenagers living with their parents and families are often conform to the conservative heteronormative norms of their throughout the adolescent life. Once they get the freedom of adulthood at universities and workplace, they intend to experiment in a way it could be risky. The stigma associated with HIV is another barrier as a double jeopardy. On the other hand, the communities discriminate against their sexuality and their gender diversity. And the other, the stigma of STI, which means and there's a need an ample research to show that intersectionality of HIV and AIDS in the LGBT community is a vicious cycle. And discrimination are being made homeless for their sexuality, that robs education, that shelter, which means the socio-economic status has been even worse, which have led many young people engage in petty crimes, sex trafficking, and sex work there's no choice of their own, but the simple base of survival. This means also there's more room for abuse and exploitation and the high demand of risky lifestyle. And this may seem cliche from a sob story from a novel or like a movie, especially for many people from the Pacific small island developing states. And we really need to break the cycle. And we need to really engage faith-based organization in the Pacific where culture and faith play a vital role in our daily lives, and have gender-affirming theology and that profess the message of acceptance. The Sojias community needs and deserve more than just tolerance. They need to feel as part of the community, as communal societies, and we deserve understanding of empowerment and to be heard and also contribute as any other person. There's also a surrounding support from leaders to defend human rights as these profound effects of fulfillment commitments for young key population, and the key is the inclusion and meaningful engagement of young key population. And as as we end the conversation, I hope that as part of this movement, we need to create a necessary change for the lives of the people who are at risk of HIV and AIDS. And we need to really move away from treating HIV and AIDS as a standalone issue, rather a cross-cutting and intersectional problem that requires all phases of society be part of owning the problem and creating solution. A big level.
Thank you very much, Calisito, for bringing all these issues. And you mentioned so many like challenges, social, economical, cultural as well, like human rights violations and stigma, discrimination in your region. And I think so that, in each region we can find some specifics, but what you mentioned about your region is like really crucial, and there should be some actions made to make these changes. And you actually mentioned all these actions. And one beautiful point which you mentioned was, which actually I think so is also nice to kind of try to close up our session before we are going to a discussion, questions answer section, is that leave no one behind. And leave no one behind means also all we young people, but leave no one behind doesn't mean just have these people. It also means like meaningful engagement of young people from different key populations. So thank you so much for all your thoughts. And I would like now to invite all our speakers, Ekonem, Ali, Aplesta, and Calisito, to join me here in the questions and answers section, because we do have some questions. And the first question would be for Ali or Ekonem, or both of you. Both of you can also respond to it. So why isn't it important for young people to be engaged in decision-making processes? And how do you feel about creating a better age balance at these tables?
All right, thank you very much. So how do we engage young people at this table? So first of all, I'll give you my experience here in country, and I'll leave Ali to the rest. So there's this saying that goes that if you're not on the table, you are probably on the menu. So in country, you see, because of the laws, the discriminatory laws we have in country, sometimes we have some representation of young persons that are not on the table, like the young key populations that are not recognized by the Ministry of Health. So what we have tried to do was to, like, if you go for a meeting, you go for, let's say, a policy review meeting where some of these issues of your youths are being captured. What I do is to let the Ministry of Health know that I'm a straight young person. I can't definitely speak for the young female sex worker. I can't definitely speak for the young person who use drugs. So why don't you get a representation of these persons here in the meeting so they can tell you their issues, so then you can then tailor the policy to their needs. These are some of the strategies that we've been using, and as of today, I can tell you that the adolescent health and development policy document that was developed captured the issues of some of these young persons in their diversities, their needs. And this is because the Ministry of Health got to respect the opinions of other youth leaders speaking for the rest of the marginalized young persons that are not on this table. So I think we can also use this strategy to, when we go to these spaces, we also ensure that we speak up for these persons that are not there. Because the truth about it is we are opportune to be at the decision-making table, but we can't definitely speak for everyone. So all you do is to speak that for the next meeting, you should have those people represented there, since you are there already. And so I think these are some of the strategies that we can use. And as well, we should also know that aligning our efforts, not just as youth organizations, but as youth leaders that are working for a collective goal, that we need to be open to share information to our other member organizations that are working in the space as well, because sometimes where we fail is when we hoard this information for the benefits of our own organizations. But I mean, you can't run an advocacy with just a single effort. You need everybody's voices to come together, and you'll be able to yield impact. And advocacy is a long-term goal, and I think the more people we bring together, the more impact we will be able to create. I will leave the rest to Ali. If he has something to add. Over.
Thank you. I will add a few points from my own experience. Similarly, I said, why is it important to involve young people is because data shows young people are the ones that are most affected. When you see the number of new HIV cases, you find that the young people are the ones that make most of the number of the new cases. So that is why you need data, and you need to know why it is so in the young people, and why it is so in the, like for in a developing country, or why it is so in the conservative society. So, and apart from that, the things around in the world and the scenarios are changing very rapidly around the globe. The young people and the new generation are not might not sometimes get the information as being earlier being conveyed. For instance, I will share an experience, like for my initiative on the ground high voices, we try to convey the information to young people via written documents on the HIV prevention, but observe that sharing and showing them animated videos and engaging them into games that better conveys how they can prevent themselves, how YKPs can prevent themselves and use those protective measures. They catch more things from that thing, like from the social media and that thing. So that is why that the young people absorb things differently, and the young people are the ones that are most affected in this world and in current scenario. That is why we need to engage them more. And when it comes to how I feel, when it comes to a age balance and representing at such tables and platforms, so it feels very good. I would like to thank Iman, who in the start appreciated my work. I was very active on the social media in the HLM activities. So I will say it's like it is important and for young people to be at platforms which are at policy makers, because when we are making decisions that we are creating advocacy campaigns on the ground with young people, involving resources on, like as earlier said, on a content that might not be absorbed by the young people. So to make such decisions that can be effective for young people, it is very important to involve young people on such platforms. And it makes me happy that we are representing young people, because we are not actually working for just current YKPs as a young people. We are making strategies and policies that will be effective for upcoming generations, and that people that will be or generations that will be coming after us or after a time.
Thank you so much, Ali and Itara. I think so. What you, Ali, just said is that we are the future, and we are the one who are now making and bringing some changes, and we should start to do it from ourselves, right? And so maybe other generations which will go after us will be in a better, I know, positions, will be more meaningfully involved, will have more possibilities. And it also reminded me of nothing about us without us, right? Slogan, which is like really quite a lot used in our communities, but you can't, like make a decisions without involvement of us, without knowing our needs, without our voices, because first of all, you need to listen to what we really need and who we are, and to understand our communities, to develop or suggest something for us, to make something better for us. So thanks a lot for your answers. And we have another question for Aplasta. So Aplasta, addressing inequalities will help us end AIDS. We need to strengthen capacity building initiatives for young women and girls in leadership roles. How can stakeholders and donors support these programs?
Thank you, Elisa. I think that's a very interesting question. So yes, through our own experiences, we see that young women and girls are not ready to voice out their problems, their opinions. One is because of they fear that they would not be able to speak properly or express their problems. And this is where I think capacity building programs would really help. And again, when we have to implement capacity building programs, we require the funds, to organize them, like my fellow speakers have stated. So I think when it comes to funding, that is where the donors and stakeholders would make an impact. And also sometimes the question that arises is, why do we need to have these capacity building programs? So I think one way we could engage our donors and stakeholders is when they come face to face with these young women and girls, and actually be in interaction with them and actually know what are the problems and the issues that are faced by young women and girls.
Thank you so much, Aplasta. So yeah, and I think so that in all the world, actually, we see like loads of great examples of the capacity building programs and how they are improving also the lives of women from different key populations. So this is probably, one more thing like why the donors and stakeholders should support the programs, because they can see how all these great examples from the world are affecting and changing to the better the lives and well-being of women. And I see we have more questions. So we have two actually questions for Kalisita. So maybe I will start with the first question, and then after your answer, we can go to the second one. So the first question is, what measure is taken for countries that have policies and laws that prevent young persons LGBTIQ specific to access HIV services? Kalisita, are you with us? Do you need me to repeat the question?
Oh, yeah. Sorry, my face. Oh, sorry.
Yeah. So I can repeat. So what measure is taken for countries that have policies and laws that prevent young persons, LGBT IQ specific, to access HIV services? So what are the what measure is taken for countries that have all these laws to prevent young people to access HIV services? Okay, I think so. We lost Kalisita, but let me check. Okay, I see that, yeah, he's out of our participants list. So maybe, yeah, there was like a connection issue. So anyways, let's, yeah, let me check, like, yeah, we have one more question to Kalisita, and we have one more question, I see. So should I take this question? I hope so I can take it, because I see that, sorry if I'm not pronouncing correct, there's Aisato. I'm sorry, like he, she, not sure the pronounce, writing that at this point, it's very much important to put into action the agreement of the HLM by supporting youth-led organizations with a goal of directly engaging communities with outreach activities. The lack of internet access for many in Liberia makes community engagement ever more vital to combating the issue that affect adolescents and young people. So now the question is, what are some of the best strategies that can be used when engaging with vulnerable communities besides the mainstream use of internet? So maybe somebody of the panelists would like to respond. Yeah, Ali, please.
It's very interesting, as I just worked around few activities on based, like especially in this COVID situation, we have gone more. It is, as you said, it is difficult to and how we can engage YKPs. So it is very important, like if we are engaging MSM community or someone like the young people who use drugs, so we can engage them from their platform, which they reach out for their information. For instance, like we can share our information or campaigns videos on websites or applications that are being used by those YKPs and that are being a kind of normal day-to-day things they use and adopt and they surface. So when we will be using that particular things that YKPs approach, for instance, as you said, in Liberia or any country where it might be difficult to reach YKPs, but what is the power of internet that we might not be able to get to them? They YKPs living in any corner of your country, it might be in a rural area or somewhere, they can, when access their basic apps or websites for their day-to-day life, we can access them from them. So this is one thing you can use to reach your YKPs where there is internet.
Thank you, Ali. Okay, I'm giving now word to Itora, and then we are finalizing the session because we are a little bit running out of the time. Itora.
Yeah, thank you, Alicia. Aisha, yes, I understand your concern. I mean, in basically here in West and Central Africa, since COVID, it's engaging with your constituency has actually been an issue. I think this is some of the things that we've been facing, but what has been one of the best practices that's actually worked is actually working within the peer group. So you have a peer support groups for the young persons you are working with, either young key population, either the young periods, either the young female sex workers, either the young LGBT, right? You work within these peers. So we have networks. There are networks, for example, there are networks in Nigeria that belong to a network at the global level. And also this kind of information can be downstream through these networks. And when it gets to the national, that is in country, the networks themselves, and can then reach out through the peer support groups that are working at the community to actually reach out to some of those persons. Yes, we understand that you have to adhere to COVID guidelines, but I mean, there are a number of gatherings that you can keep that is actually healthy for you to actually have like a face-to-face gathering with face-to-face engagement with the young persons that you are working with. So aside mainstreaming internet, I think you having the opportunity and having access to internet when you go back to Liberia, while in Liberia, you can then bring some of these informations and work through these peers in the communities, and then you'll be able to support them in the best way that you can. This is what I can say for you. Thank you.
Thank you so much, Ekonom. And yeah, thank you all the panelists for a great discussion, for answering the questions and bringing all these important issues. And now I would like to invite Gareth Jones from UNAIDS and PACT to make our reflections on all the discussions which we had today. Gareth, word is yours.
Thanks, Eliza. I'm going to keep this very short. I am very much aware of the time, and the participants and the moderators have done a fantastic job in summing up, bringing some really important points. Just to make a very quick reflection and then a final request, so everyone, if you can please stay on till the end. I have a request from Eddie, who is involved in the organizing of this. Just some final points is, and I think it's been said already, but just to really reiterate, is that the HLM and the political declaration are only the starting point. We've got 8-9 more years until we've got that goal that we've set ourselves of ending AIDS by 2030. We did a huge amount of advocacy. The different youth networks here, both of the ones represented by the panelists and the ones represented by the participants and the audience, did an incredible job, and it was a massive lift in a very, very short space of time. But we've got much, much more work to do, and we've got a lot further to go. So really making sure that we see the HLM and the political declaration as a starting point and not an end point and not a goal is going to be really, really important. It was brought up, but just to again reiterate that these clauses around cultural sensitivity and national sovereignty are very worrying. They are sort of the get out of jail free card that member states put in. But it doesn't mean we can't try, and it doesn't mean that we don't continue to advocate, particularly those of us at the national level. Around CSC, it is going to be a huge uphill battle. Not only did we see it becoming a huge sticking point at the HLM, it was also the World Health Assembly the week before the high-level meeting. I think member states were hugely emboldened, those who are against CSC, by what happened at the World Health Assembly. And what we did see is that there is a huge amount of teamwork almost, and an impressive amount of organization amongst those that are against CSE. So it's really important that those of us that are for it and those of us that are pushing it, and it is critical in the AIDS response, that we have that same level of organization, that same level of teamwork on the different on CSE. Sorry, I just saw that message Eddie put in the chat. I think Ekonom brought up a really good point, and that's not to get discouraged. Advocacy is a very, very slow process. You know, the AIDS response has been going on for 40 years. I've been involved in advocacy projects that were started before I was born, and we only got the results a couple of years ago back in my own home country of Ireland. And it's just important to remember that these aren't going to be quick fixes, that, you know, we need to continue pushing, and no matter what sort of pushback we get, no matter what progress we see being made or progress we see not being made, it's really important that we just continue fighting the good fight. And making sure that we take this to the national level. If there's one last point that I would say to everyone here is, you know, working at UNAIDS, having been involved in global civil society, that these are important, these global forums are important, but the most important thing is going back to our own countries, going back to our own governments, our own representatives, and pushing these points. And that's what us as global networks are here for, is to support you in utilizing these global advocacy tools at the national level. So I think that is it. I'm not going to talk anymore because I am very aware of the time. Eddie has just requested if everyone can turn on their camera so we can do like a little group photo at the end. So that's all the participants as well. I believe everyone feel free to join in, and we can finish up. And this won't be the last you hear of the HLM. It won't be the last you hear of the political declaration. But this is, as I said, this is the starting point, and us as networks, as UNAIDS, we're here to support you with that. So I will stop talking and I will let Eddie take over for the photo.
Thank you, Gareth. Yeah, if everyone could just quickly turn on their cameras so we can take a group shot, and then I can let you go back to your daily lives. Okay, just give it a couple of seconds. Okay, so Vanessa, could you help us with screenshots? Thank you. 1, 2, 3. Fantastic. Thank you so much, everyone. Thank you, Gareth. Thank you, everyone, speakers, moderators, and everyone for joining, leaving your questions. It's been great. Please stay in touch. Keep up the good work. See you soon.
Could I just ask just someone on Youth Lead, if you're able to save the chat, because I think there were some questions that might not have got answered, so that maybe the PACT and Youth Lead and ourselves at UNAIDS can maybe do some follow-ups. We can either publish it or send some emails out.
Yeah, for sure. I can take that.
Awesome. Thank you.
Thank you, everyone. Have a good day.
Thank you. Thank you, everyone. Thank you, Eddie.
So much, everyone. Nice meeting you all.
Thanks, Alex.
Bye. I'll end the meeting.
Yeah, on Facebook.
Okay.